All right, we had talked a little bit about fluctuation of estrogen and progesterone during the period. So this is how I explain it to my ladies. At the beginning of your period is day one. On that day one, you start making a new egg in your ovary, either the left ovary or the right ovary. That egg develops and grows. As it grows, it's making estrogen. So the estrogen rises. So in some people, the estrogen peaks around that 2 weeks from your last period. They start feeling the breast tenderness, they start feeling the bloating, all those symptoms that, oh, I'm ovulating. And then once you release the egg, progesterone rises. So estrogen comes down, progesterone rises. The progesterone is technically supposed to support the pregnancy if you get pregnant. So that's why it rises. And so if you don't get pregnant, the progesterone falls. So there's this rise and fall of estrogen, progesterone during the period. A lot of people are super, super sensitive to that fluctuation, and that creates symptoms like PMS. I know you had mentioned PMS yesterday. Can you tell me some of the symptoms that your patients come to you for that makes you think, oh, you have PMS?
I don't get, to be honest, I really don't get too many issues of concerns about PMS, other than maybe a teenager will comment that they'll have diarrhea or nausea, vomiting, or
Mm,
constipation during their menstrual cycle. So
yeah.
they'll mention those GI symptoms, which
Mm-hmm.
you did talk about the pain centers, right? The prostaglandins. So
Mm-hmm.
that's really what's coming out of it. So I don't really go into too much detail like, you just did, which I really liked,
Mm-hmm.
because I've forgotten about the exact timing.
Right.
I just go there. I just tell them we have female hormones, estrogen, progesterone, and they go up, and
Uh-huh.
they make these terrible things called prostaglandins go up, and that's what causes the stomach, the intestines to get really angry and inflamed,
Mhm.
and that's why some girls may have constipation, some will have diarrhea, some
Mhm.
will have nausea or throw up.
Mhm.
And so I get a lot of those kind of things where they'll say they feel really sick to their stomach when they're going to have their
The
period.
period. Yeah, and those are mostly progesterone effects. Like I had a patient who had severe like nausea, vomiting during her periods, and they wanted to put her on birth control, and they gave her an Explanton. And I said, that's the wrong birth control, right?
Hmm.
She's super sensitive to her own natural progesterone with the nausea, the vomiting, the bloating, and then they put another progesterone hormone in. And someone like that, you use a lower dose progesterone, higher estrogen to kind of keep her balanced so that because she's super sensitive to her progesterone levels being super high. And the main things I get is the nausea, the vomiting during periods, the severe pain, the breast tenderness is super, super tender, bloating. Again, birth control. And choosing the right birth control, right? Uh,
Yeah, like I wouldn't have known, as a pediatrician, I wouldn't have
mm,
really known that an Nexplanon wouldn't be a good idea for a patient like that, because really, like for teenagers, really we try to tell them maybe a great thing for you is a long
long
acting,
term, yeah.
long-term thing. And so, a long-term idea like a Nexplanon would be a good idea. But in that kind of case, maybe that's a no-go,
Right.
for that kind of patient. So that's a
Yeah.
really good point.
Yeah.
Maybe that's something that a patient would want to bring up to their doctor and say, oh, I have these symptoms with my period.
Mhm.
Are these, because when we kind of think about options for birth control, a lot of times we're thinking about convenience, right? Daily
Right.
pill
Right.
versus wearing a patch versus a
A
ring versus,
ring,
the implant on
implant
versus
on,
the IUD.
IUD.
We're thinking about what's more convenient to your lifestyle and what's going to give you the biggest bang for your buck, in terms of maybe a teenager getting through college and things like that without having issues with pregnancy. But you also have to think about what are your periods actually like
Mhm.
you're saying.
Right, absolutely. And, you know, I always recommend those long-acting reversible contraceptives, like you mentioned, the Implanon and the IUD for young people who are going off to college and may not remember to take a pill every day. But I also like the patch and the ring. I love the convenience of it, the fact that you don't have to do same time every day. There's some people where, you know, they can set an alarm. The pills work great for them. There are more options with the pills. There's so many different kind of doses. So depending on how they react, you can mix and match. But you know, my basic, just like you said, getting a good history. What are your periods actually like? What is your most bothersome symptom during your periods? Is it the pain? You know, if it's the pain, the IUD is a great option. It reduces pain. If it's the bloating and stuff, then maybe we want to give you an estrogen progesterone combination that will kind of keep things steady state. And the PMS symptoms too, sometimes they get really moody, they get really irritable. In those people, we just put them on birth control because then it tells the ovaries not to do that fluctuation. So the ovaries don't do estrogen rise, fall, progesterone rise, fall. They just get their estrogen and progesterone from the pills. And that would sort of remove that moodiness and irritability and stuff that and the bloating and the stuff that they feel during their periods. We do continuous birth control where we don't even tell them to have a period when we're dealing with endometriosis and stuff like that. But for PMS, people who find that all those symptoms are affecting their daily life, maybe those symptoms are happening, but they're not really bothersome to you. But if they're affecting your daily life, then it's something that the right birth control can solve for you. Awesome. Anything else you want to add, Dr. Emma? Any uncommon knowledge that you want to make common?
I think too, like flow. I think we could talk quickly about flow and what normal
Oh,
and
right.
flow
Absolutely.
is, since we're talking about
Absolutely.
periods.
Absolutely.
So, you know, what do you say about in terms of flow?
Flow. So when I ask ladies, I ask them if they use pads or tampons. And then if they use pads, I ask them, are you using maxi pads? Are you using the big diapers and stuff like that? If they are using diaper or thick maxi pads and soaking through thick maxi pads, then I consider that too much bleeding, right? So, and I ask them if they have symptoms of lightheadedness, if they have symptoms of, you know, everyone gets a little fatigued during your period, right? Unless you're on birth control. But if it's like you spend the whole day in bed, you're so tired, you can't even do any sort of period symptoms that prevent you from doing your day-to-day activities, that's too much flow. If you're having to get up from the chair and look back to see if you've stained, that's too much flow. If you have to change your pad every hour, that's too heavy flow, you know? Most people use like 3 pads a day. Sometimes they feel it on their heavy days, on their lighter days, they don't feel it. If you're feeling it all the time, you're changing every hour, you're looking back whenever you get up from a chair to see if you've stained, that flow is too heavy. And you need to see a gynecologist about that.
I think
Also, if
for
it's lasting longer too, if it's lasting longer than 7 days.
I think normal for a teenager or a young a person is 6 pads in a day.
6 pads in a day?
3 to 6.
Okay.
3 to 6 pads or tampons.
Okay. Are they filling those up or because sometimes I feel like they just change it because they're going to the bathroom.
Well, that too, but I think I just was in a grand rounds and the guy said 3 to 6. But yeah, sometimes which is good, you know, for learners is hygiene wise, you know, changing with every washroom use and things like that, is that, you know, if they're going to the bathroom, changing is a good habit when they're first learning and things like that. You know, I've had some parents give them just panty liners. I don't think that that's a good thing to do. I think
No,
that they
right.
should be using a
Actual pads.
regular pads, yeah, and not being using panty liners. I think that tampons are okay in teenagers.
Right, right,
Um,
right.
you know, if they can use it, you know, responsibly, you know, if they can
Right.
remember to change
Take
it,
it
because
out.
as you know, they can get a serious infection if they
Mhm.
leave their tampon in.
And
So if they're not responsible in changing their pad, they're not going to be responsible in changing their tampon. So do
mhm,
not buy them tampons.
mhm,
Same
mhm.
thing with a menstrual cup. If they're responsible, you know, it's okay to use a menstrual cup,
Right.
but if they're not responsible, that can cause a blood infection.
Mhm.
So it's not a good idea.
Right, right.
Um,
The tampon one, to talk about flow with regards to tampons, if you're using like the ultra tampons and you still have to use a pad with it, I consider that, a heavy flow where it leaks, because the tampon is supposed to soak that up and expand to absorb the blood. So if it's done that and the blood is still too much, then it will leak out. And then you have to use another pad on that. Then that defeats the purpose of having a tampon. And so I
yeah.
would consider that heavy flow, and I would investigate that further. But you are right. I have had patients who, now these are not teenagers, these are maybe mid-20s. They forget they have a tampon in and they have sex with that. And then they get an infection, and then they come to me and say there's a horrible odor and I don't know what it is. And then I
Oh,
look inside and it's a tampon there. And I have to take it
oh,
out. So you're right. You have to be responsible if that's your choice of use. You have to remember to take it out.
yeah, super
Yeah,
important.
yeah,
Yeah.
yeah.
Mhm.
Awesome. This has been so helpful. I've learned so much from you. Thank you for spending your time with me today.
Yes, and just because we use sometimes the, you know, the pronoun she and ladies, and we
Mhm.
do understand that, you know, people who have periods also identify as non-binary, and we don't want to be, you know,
We want to
exclude
be respectful.
that. Yeah.
Yeah, yeah. Awesome. Thank you, Dr. Emma. This was so
You're
fun.
welcome. All right. Thanks so much for inviting me to
Absolutely.
your
To my show, right? I think I
yeah.
technically have a show.
So proud of
But no,
you,
I learned so
Dr.
much.
Taiwo.
Oh, thank you. Thank you, Emma. I appreciate that.
These teenagers are very smart.
They are.
They know more than we know.
You think they know.
Yeah, yeah.
Yeah, absolutely.
They know about HPV, they know about endometriosis, they know about PCOS, they
They
know about
come in
PMS.
diagnosing themselves.
They
And then
do.
I have to walk it back and say, do you really have this condition?
And
Yeah,
sometimes they actually do.
they do.
Yeah, they're very
Yeah,
smart kids. Yeah,
yeah.
or teens, whatever you want to call them. All
Thank
right,
you,
thanks so
Emma.
much.
So much fun.
Likewise.
Take care.